Thank you, Mr. Chairman, and thank you to all of our witnesses for being here today. The increasing prevalence of xylazine in the United States is a dangerous trend. Public health officials have warned of the skin wounds that can occur from repeated use of xylazine and the risk of worse health complications if the wounds are left untreated. How much are healthcare providers aware of the dangers of these health complications, and how best treat them, Dr. Westlake?
Yeah, so I just actually saw a patient with ulcers from xylazine about 2 weeks ago. And I asked him why he was doing it, and he knew the risks associated with it, and he just couldn't stop himself because he liked the high too much. I mean, that's the issue is that the xylazine is available. And you know, it's not scheduled. It's legal to get it shipped in now. And so that needs to change, you know, whether it's placing it as a Control 3 scheduled drug or placing the same restrictions that Schedule 3s have on it as far as being imported and monitoring it. Treating it as, you know, treating the ulcers aren't, it's difficult, but it's the problem is that it's there, that it's happening.
So what steps can policymakers make on the state or the federal level to increase the awareness of xylazine-associated wounds and treatment options amongst healthcare professionals?
Yeah, I think just encouraging the awareness. I think there's a pretty broad awareness of it now, but I think the way to get that done is to get it spread through the local like specialty organizations like American Academy of Pediatrics, American Board of Emergency Medicine. You know, it's not necessarily through federal. It's spreading it out through the networks that the doctors listen to.
Okay, thank you, Sheriff Bouchard. In my district, the Morris County Sheriff's Office partners with the County Health Department, the Mental Health Association, the Morris County Prevention, to operate Hope One, which is a vehicle that travels to sites throughout the county to provide services and supports for those struggling with addiction. At these sites, the vehicle provides immediate access to services, to treatment facilities, and Narcan training and kits. In fact, at least 177 of these Narcan kits have been used to save a life in New Jersey. These sites are staffed by sheriff's officers, licensed mental health professional, and certified peer support specialists. Can you speak to the vital role that law enforcement has in these holistic approaches to treatment?
Yes, sir. Thank you. It's critically important that we're all connected, whether it's health, prevention, or law enforcement. As I mentioned earlier, we're typically the first one on scene at any situation. CBS, I believe, National did a story on one of my deputies saving a woman in a Dollar General. You know, typically we are around and spread through the community. Fire departments or EMS comes from a station. Lots of times we get there first, and those first 2 or 3 minutes may be critically important to saving that life. So that partnership and then the handoff to follow-up care and to prevention in the future, that's where our crisis response unit and our partnership with the health department comes in.
Okay. Can you speak to how drug trafficking contributes to violence in communities and how law enforcement is an essential component in combating illicit drug threats?
Yes, you know, when you think about an establishment, let's say a McDonald's, if an armed robbery there, they're going to take cash. When you've got even a legal licensed facility, whether it's a pharmacy or a medical marijuana or a marijuana facility, they both have cash and drugs. And so what we're seeing is the violence that are directed sometimes at armed robberies or situations there are much more escalated. We had a homicide about a week and a half ago at one of our licensed marijuana grow operations where they came in, just barely creased the door and shot the individual in the face and killed him, and then stole 50 pounds of marijuana. So they tend to draw attention for armed robbery and for ancillary drug activity.
Okay. And earlier in this hearing, you responded that today Americans can get xylazine mailed to their house from vendors in China. Can you walk me through how that process works or any current barriers that exist to this emerging danger?
At this point, I'm not aware of any barriers. We've been trying to get a state law passed to deal with xylazine. It's still not scheduled on the national level, so there's not a barrier to shipping or mailing something direct to an end consumer that's not prohibited by either state or federal law.
And do you have any advice for how to combat this international flow of xylazine in the United States?
I think it needs to be scheduled. I think we need a whole of government effort to, as I said, nimble enough to deal not with xylazine, but what's the next iteration that's going to come down the pike.
Thank you. I yield back my time.